information. We know that coronavirus has affected all over the world. Doctors and scientists are working very hard to find the vaccine. Countries like America and Russia, as well as our India, are very much affected from coronavirus. To fight with our enemies, we should know it very well. So, let's start the video. First of all, we will talk about the most common symptoms of coronavirus. They are fever, dry cough, and tiredness. Serious symptoms are sore throat, chest pain, loss of taste and smell, difficulty in breathing. Now, let's see the video of day-to-day symptoms.
The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Day 7. The patients that haven't started recovering by day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease and are discharged from the hospital.
Prevention of coronavirus. Prevent yourself by knowing the fact and taking appropriate precaution. Follow the advice provided by your local health authority. First, clean your hands with soap and water or hand sanitizer. Second, maintain social distancing from everyone. Third, cover your mouth with mask. Fourth, don't touch your eyes, nose and mouth. Fifth, cover your mouth with your elbows or a tissue paper when you sneeze or cough. Sixth, if you have fever, cough or difficulty in breathing, seek medical attention. Seventh, eat healthy foods which contains more amount of vitamin C and many more nutrients which helps us to increase our immunity power. Eighth, we should follow the instruction given by our government. Stay updated by watching news. These were the remedies to be prevented from coronavirus. At last, let's see the
The large S glycoproteins are used by the virus to gain entry to human cells. They most likely attach to angiotensin-converting enzyme 2 receptors on the cell membrane, allowing the virus entry. The exact mechanism for this is not known. Most likely, as shown here, the human cell ingests the virus in a process known as endocytosis. Once inside the cytoplasm, the endosome opens to reveal the virus's genetic material, a single-stranded RNA. The virus hijacks the cell's machinery to replicate the RNA in N proteins and uses the endoplasmic reticulum to form its M protein outer layer and the all-important S protein. After replication, the virus is carried by the Golgi bodies out of the cell in a process known as exocytosis, so that it can infect other cells. Meanwhile, the stress of viral production on the endoplasmic reticulum eventually leads to apoptosis, or cell death. It should be noted that the mechanism of action for 2019 novel coronavirus is unknown. However, scientists in China have sequenced the genome, while others have used the sequencing to visualize the structure.
I hope you enjoyed this video. Press the like button, vote for me, and share it to maximum people so that we can spread awareness regarding coronavirus. Stay home, stay safe. Thank you.